against automation, but in places here like here in Iowa, we just don't have enough workforce. We're not putting people out of jobs if we choose automation. Is that something that the federal government should be encouraging?
The federal government should be encouraging
Automation in healthcare, especially in places like Iowa where we don't have enough medical staff and workforce.
I'm very passionate about this. And you talk about the medical lobby. You have to look around and ask, why the heck do we have a doctor shortage here in this country? Everyone knows we have a massive doctor shortage and primary care physician shortage. And the people that bear the brunt of that are people in rural areas who look up and say, you know, I have to drive like 60, 70 miles to be able to see a specialist or a doctor. There are a couple of big reasons. You have a medical lobby that's been artificially constraining the supply of doctors for decades. Like, you looked up and said, we need more doctors. And the medical lobby is like, we're going to just keep it just as it is. And then the next question you ask is, okay, we don't have enough doctors, then how about you let some non-doctors do some things? And again, the medical lobby is like, no, got to be a doctor. And so that's why we're in this bind where the incentives, unfortunately, for the medical lobby are to constrain supply. So you have to go through this incredibly expensive training process. And the training process, you know what that means? That means that no one wants to be a primary care physician, because you load them up with $200,000 in med school debt and say, guess what? If you specialize, you get paid more. Then what do people do? Be like, well, I guess I don't want to be a family doctor because that means I'm going to make less and I owe $200,000. So how about I just tack on another couple of years and then I can become like a radiologist or an oncologist or something that's going to be more lucrative, and I'll see if you were paid. So you have...
Furthermore, you can't go work for the VA either because you don't get paid enough.
Yeah. So you have these two constraints on supply, or three really. One, you have the constraint on doctors. Two, you have the constraint on non-doctors actually being able to treat people and see patients. Three, the training process means you have a massive shortage of primary care doctors because you're incentivizing all these doctors to go into specialties and go to urban areas that can pay them more. Now, so you have to attack all three of these things. You have to increase the supply, you have to try to decrease the cost of training that falls on the individual, and then you have to loosen up regulation and say, look, if you're in a rural area and there are no MDs around, or the MD to population ratio is below a certain level, guess what? Nurse practitioners should be able to do like 85% of what the doctor is doing, especially if they can be supplemented by technology and AI. Or you have telemedicine. I was just meeting with a friend who's now licensed in all 50 states, and you can have telemedicine that pipes in. So what would be reasonable for many rural communities is you empower nurse practitioners or primary care providers that aren't MDs in that community, and then if they need to refer to a doctor, then they beam the doctor in, and then you get that done. And that's something that would be much more achievable if the medical lobby wasn't trying to keep it from happening.
Isn't that a state-by-state question on who you license and what you allow them to do? I mean, the federal government obviously is involved in the healthcare industry and medical regulations, but you know, some states could decide that indeed nurse practitioners should have X power in order to get a license, and some could not.
Yeah, but one of the reasons why this is such a disaster for patients and consumers is because the medical lobby has intentionally pushed a state-by-state system, which makes it so if I'm an MD, I get licensed here in Iowa, then I'm not supposed to see anyone like in Minnesota and whatnot. And so that's another way they artificially constrain supply. That if you can lower and if you actually look at the substantive differences between being licensed in different states, like this, it's like we know that if someone's a doctor and they pass the licensing test in one state, like they have 95% plus of what they need to be licensed in the neighboring state. It's just they've set up another process and another expense and another time-consuming set of hoops to jump through to try and keep you from being able to practice across the border, really just to protect the doctors in each area.
So you would take licensing power away from states and give it to the federal government so you could enact the system?
I would encourage multi-state licensing based upon the substance of the tests. And so if there was a state that had a genuine substantive difference saying they really do need to know this thing, but in many of these cases these distinctions are somewhat marginal or artificial.